Hello everyone, I am Sara Yousef and I will explain the basics of ECG. I hope you will have a good journey with the most interesting subject. First of all, we will talk about the concept about ECG or the benefit from ECG. First, we can measure the heart rate by calculating different intervals such as RR intervals. Second, we can correlate with the fluctuations in electrolytes such as sodium, potassium, calcium as it affects the depolarization and repolarization. Third, we can correlate the ECG with cardiac muscles abnormalities or conduction system abnormalities such as arrhythmia. Now, we need to explain an action potential. What is an action potential? It is a brief change in voltage across the cell membrane. We know that in the normal state or in the resting state, the cell charge inside negative and outside positive. But during an action potential, cell polarity change from negative charge to positive charge, and this is a process called depolarization, and that occurs because of the sodium channel. Then cell again change its polarity from positive inside to negative and outside positive. This is a process called repolarization. Okay, if we have two sets of different charge, we call it dipole. And in the next slide, we will talk about the dipole in more details. Okay, if the electrical impulse that travels toward the electrode, it forms the positive or upright deflection. But if the electrical impulse travels against the electrode or toward anode, it forms a negative or downward deflection. Each of which, if it is upright or downward deflection, it is directly proportional to the dipole. A greater dipole, a greater deflection. The most important example in this process, QRS complex. And this will explain it more in next slides. An action potential occurs in the conductive system of the heart, and the main pacemaker of the heart, sinoatrial node. Sinoatrial node spread the depolarization to the entire heart, and it controls the rate of beat to the entire heart. Sinoatrial node give a lot of branches, but we'll not talk about it in this presentation, but we will move directly to the atrioventricular node or AV node, which is a backup pacemaker. What is the meaning of backup pacemaker? If there is any abnormality to the sinoatrial node, it will be the main pacemaker of the heart. Okay? And AV node slows down the conduction of impulse, or in some references, it calls stop the action potential. And this stopping the conduction, it refers to a PR interval in the ECG, and that we'll talk about it in next slides. After that, we have a bundle of hairs, and bundle of hairs give us two main branches, which is one in the right and one in the left, for the left ventricle and the right ventricle. And just to notice something, we have too many branches in the left more than in the right, and that's because of the greater muscles in the left ventricle than the right ventricle. Finally, we'll have the Purkinje system, which is also a backup pacemaker with high velocity. Now we will move on to the ECG. ECG is abbreviation of the word electrocardiogram, and in some region it's called EKG, which is a tool that's used to visualize the electricity of the heart. Each event has a distinctive waveform, And we talked about the reasons in the previous slides, if it is moving toward or against electrodes, or if it has a greater dipole. These changes can be detected by electrodes attached to the surface of the body, and we have 10 electrodes and 12 leads. ECG is essential for diagnosis and management of cardiac rhythm. And the name of the machine is called electrocardiograph, and while the name of paper is printed is called electrocardiograph. Now we'll talk about the waves that form by ECG. First wave, we'll talk about it. It is B wave, which is atrial depolarization, but no contraction occur here. Okay. After that, we'll have the BR interval, which is the time between the beginning of the B wave to the time of beginning of QRS complex. Here there is delay because it allows more time to atria to contract and empty its blood to the ventricle. After that, we'll have the QRS complex, which is a ventricle depolarization, and we will talk about this wave in more details in the next slide. And then we have the T segment, which is the time between the depolarization to the beginning of the repolarization. After that, we will have the T wave, which is the ventricle repolarization. The last thing is QT interval, which is the time period when ventricle depolarization followed by ventricle repolarization. Now we will link between ECG and conductive system. We will start from here. Atrial excitation begins with SA node until it reaches to AV node, forming the B wave. And as I said before, there is no contraction occur here, but it is full excited. After that, after the BR interval finish, it is empty the blood to the ventricle. After that, we'll have the Q wave, which is interventricular septum depolarization. After that, we have the greatest wave, which is R wave, which is the ventricle depolarization. And then we'll have the S wave, which is the depolarization of the basis of the heart, and it is forming a negative deflection because it is against the electrode. After the ventricle is full excited, it will eject the blood outward, and it reaches to the repolarization state, forming the T wave. To interpret the ECG paper, we have to look to two important things: horizontally and vertically. Horizontally means time, and it measures by second, and vertically it means voltage and is measured by millivolts. One small square horizontally equal to 0.04 second, and each large square has 1, 2, 3, 4, 5 small squares. So 0.04 multiplied by 5 equal to 0.20 second. Vertically, one small square equal to 0.1 millivolt. So 1, 2, 3, 4, 5. So 0.1 multiplied by 5 equal to 0.5 millivolts. So to summarize up, each small square horizontally equal to 0.04 and vertically equal to 0.1 millivolt. To take an example, we will calculate different intervals and different waves in ECG. First, we will calculate the BR interval. BR interval, which is the wave between the beginning of the B wave to the beginning of QRS complex. And it has 1, 2, 3 squares, small squares. So 3 multiplied by 0.04, it is equal to 0.12. And the normal range for the BR interval, it is between 0.12 to 0.20 second. The same thing for QRS duration. It has 2 small squares, so 2 multiplied by 0.04 equal to 0.8. and the normal range between 0.08 to 0.10 second. Calculation of the heart rate. Heart rate means the number of beats per minute, and we have two methods to measure it. Either to 1,500 divided over the number of small squared between two successive R waves, or 300 divided over the number of large square between two successive R wave. And the reason we said 1,500 is the speed of ECG is 25, and the number of seconds per minute is 60. So 25 multiplied by 60 is equal to 1,500. Some ECG, they use 50 speed. So 50 multiplied by 60 equal to 3,000 and not usually used. Okay, let's use this example to measure the heart rate. We have 4 large square between two successive R wave divided over 300. So 300 divided over 4 equal to 75 beats per minute. So the normal heart rate between 60 to 100 beats per minute. Finally, we will talk about ECG leads. ECG leads divided to that coronal plan and transsphere plan. The coronal plan, which is the limb leads, and transsphere plan, which is the chest leads. The coronal plan has 4 electrodes and 6 leads. The electrodes, one in the right arm and one in the left arm, and one in the left leg and one in the right leg, which is the neutral electrode. And the leads, one from the right arm to the left arm, the second from right arm to the left leg, and the third from left arm to the left leg. And the second 3 leads, augmented vector right and augmented vector left and augmented vector foot. The transsphere plan or the chest leads has 6 electrodes and 6 leads arranged in the chest. Finally, we will talk about the location of leads on the heart. First, the second and third and AVF located inferior on the heart, which is supplied with right coronary artery, and lead 1 and AVL and V5 and V6 located on the lateral wall of the heart, which is supplied by left circumflex artery, and the septal lead, which is V1 and V2 located on the interventricular septum, and V3 and V4 located anterior part of the heart, which is both supplied by the left anterior descending artery. Finally, we finish our presentation. Thank you for your attention and thank you for your valuable time.